Welcome to the Subjective Professor podcast, where we reject coercion and hypocrisy. This is episode 284, and we're going to talk about how my parents had no health insurance when I was born, my two brothers and I when we were born. And then we're going to talk about Mark Zuckerberg at the end. So, when my father came to America, and I've said this before in another episode recently, my father came to the United States in 1959, and when he finished his seminary education, he got accepted into a doctoral program, and that's when he was able to then declare that he could support his fiance, his wife. So she came to America, and they started a family, and this was in the 1960s. And so he was a full-time student. He didn't have a lot of income, and so he didn't have enough to afford health insurance, which was okay. A lot of people didn't have health insurance at the time. And in those days, when my mom finally came to America, my father was actually teaching in universities by that time. So he was accepted into a university, but you may not know, but scholarships that are given by graduate programs come in the form of classes that you have to teach, right? So when a grad school offers, at least in the humanities, when they give you a scholarship, it basically means you have to teach classes. So he's lecturing, and at the same time, all these other colleges and universities in the area, Catholic ones, invited him to speak and to teach and lecture and teach courses. And so he got a gig teaching full time at a Catholic college, and he taught in Catholic institutions for about 10 to 12 years. Okay. And eventually he was forced to give it up, right? Because they gave him a choice: either quit preaching at your church or and be full-time faculty, or you gotta quit teaching because you just want to do this church thing, right? And so that's how he was forced out of teaching, and so he left it. But anyway, so he didn't have insurance. Uh, so what happened was that the obstetrician, the OBGYN, she was affiliated with the Catholic Church, and so she knew about my dad, and I guess he was referred somehow. And so what she said to my dad was, "You don't have to pay," but instead of paying, in lieu of payment, he was going to have to give a lecture and teacher stuff, right? So she's stuck in the office all day, and it's been a while since she listened to a philosophy lecture. They didn't have internet back in the day, and so she wasn't going to pick up a book and read it. And so she was just like, okay, every time you come, you have to be the last appointment of the day, and you have to give me a lecture that's an hour long. Okay. And of course, my parents gladly agreed to that, right? And all three of us, my two brothers and myself, we were born this way. Now, about 10 years ago, there was a bill, a hospital bill, for the night of delivery of an anonymous child. Okay. I don't know who it was, in spite of the fact that all four of my children were born at the same hospital, but I never looked at the bill. And in fact, the hospital bill was around the time when my last child was born. And so basically, it's more than likely that the billing for our last child was about the same as this bill because it was from the same hospital around the same time. And it was for $42,000 just for the night of delivery. So what happened, right, in the 40, 50 years from my birth to the birth of my children? What happened? Well, um, along the way, the government basically said we can make healthcare cheaper. And by trying to make it cheaper, we went from being so inexpensive that you could barter the appointments and delivery, all of that, for the price of a lecture. And it's gotten to $42,000. That's the government way of making things cheaper. And how does that work? Well, the government basically says, look, we'll handle the payment, right? Or we'll, through your insurance, right? We'll handle the payment, which is the signal to hospitals and healthcare providers to charge whatever they want to charge. And gradually, of course, it goes up and up and up. And so that's why you see hospitals charging hundreds of dollars for aspirin, hundreds of dollars for Tylenol, right? Because they mark everything up because the customer, right, the patient, it no longer sees the bill. And so there's no sticker shock there. The sticker shock, if there is any, is at the healthcare premiums or the deductibles, et cetera. And so most patients are completely unaware of what the itemized charges are for their hospital stay. And so therefore they don't really complain about the actual hospital bill. And again, to repeat myself, which gives this the ability of hospitals and other pharmaceutical companies to raise the prices of the services that they are providing. So here are some things off of that bill for $42,000. The obstetric room charge, I guess that's the room where you're actually delivering the baby, $6,900. Okay. The room and the bed where the mom then is sent to recover is $10,000, $10,353. The nursery for your infant, your newborn, $7,275. Post ICU, so intensive care, right? So there must have been a slight problem with the birth, $4,430. And my child also had, my wife actually had had gestational diabetes, and she had all these other issues going on because she was a lot older when we had our last. And so probably we had the same kind of billing going on. The pharmacy charge, part of the pharmacy, but a couple other pharmacy charges on the bill, $2,270, medical supplies, $840. And so you can see that it's, wow, that's a lot of money. Um, then I remember I used to, when I was teaching at the university, I would always try to talk about innovation, alternatives, right? And so instead of saying, oh, government's got to do something, right? Remind the students, no, no, no. We have responsibility. We have agency. We can come up with alternatives ourselves. We don't have to go to corrupt politicians, corrupt governments who will only raise the prices of everything, lower the quality, right? Create the circumstances where you'll have monopolization, right? Where the only person providing services is a government entity, which is a monopoly service. So what else is out there? And 12 years ago, Reason TV, so their YouTube channel, Reason Magazine's YouTube channel, came out with a video, and the title was Oklahoma Doctors versus Obamacare. And so Obamacare was being pushed through, and it was destroying the healthcare industry, right? It was totally um, um, taking away the ability of healthcare providers to provide charities and things like this and low cost services. And so here, Reason TV was focusing on this surgery center in Oklahoma, right? And so the Oklahoma doctors were doctors at this surgery, a private surgery center where they would post the costs of their surgeries on uh, in the reception area, right? And so you walk in and all the prices are listed there like a pizza shop, right? So one example they give is carpal tunnel surgery. They charge, right, the surgery center, the private surgery center, charged $2,750. Across town was the corporate hospital. They charged 7,450, right? So that's almost $5,000 more. But you have to also realize there's a deductible, and so after the deductible, uh, in, or because of the deductible, the patient had to pay out of pocket $5,299, which is almost double what the surgery center was charging. And so the employer, the person who, the entity that was actually paying for the surgery for their employee, they were like, we'll pay it, right? And so she got to get the surgery for free because it was cheaper, much, much cheaper than the corporate hospital. Fast forward to today, I believe Mises Media had a recent re-interview with the same Keith Dr. Keith Smith, who was running the surgery center of Oklahoma. He's still there, right? And basically, they've expanded. They have patients that come to them from all over the world because there's very little wait, right? The wait time, the wait, is very short, and it's so much more expensive, so that you can pay for the airline ticket, the travel, the hotel, all of that, and it's still cheaper than uh, doing your surgery where you're living with insurance, right? It's still much, much cheaper. Okay. I forget, I tried to find, but I can't, I don't even know how to search for it. But that system where the employees pay into it's not perfect, where they pay into a pool, and it has something like medical benefits. And so if you're never sick, then it just accumulates, and then when you change jobs, you take all that money with you, right? I can't remember what it's called, but anyway, there is that system when more and more employers, excuse me, are going to that kind of system so that they can take advantage of surgery centers like Oklahoma Surgery Center. Okay. So why is corporate medicine so much more expensive? Well, in addition to all of the insurance and that situation that I explained to you, where you get this green light to bill a lot more, there are a lot of administrators. And so, in that video that I mentioned from 12 years ago, they talk about how many vice presidents and how many administrators there are in the corporate hospital. And in that hospital, there are 18 vice presidents, right? High level administrators who make an average of over $400,000 per year, 18 of them. So I would imagine that there are other administrators, not aside from that 18, who are making over 300,000 or making over 200,000, all of which contribute to increased costs, which have to be covered by how much the patient has to pay. Okay. And so there's another surgery that they talked about. Let's see, sinus surgery. And so at the Surgery Center of Oklahoma, it was $5,885. And this was 12 years ago. But the corporate hospital charged $33,000. Okay. And that does not include paying the surgeon and the anesthesiologist. Okay. So you're looking at like $40,000, what is it? 7 times more than what the private surgery center was charging. Okay. And even the doctor there says, yeah, basically, um, hospitals are overcharging because patients don't see the bill. Insurance pays it. And the hospitals justify the higher costs, saying that they have to pay for people who have no insurance. But see, that was going on before, right? There were slush funds for hospitals. And I remember reading the story when Obamacare passed, they saw the slush fund for people to cover people who had no insurance, right? Every hospital had it. And they plundered it. They said, you can't have that money just sitting around, either pay taxes on it or put it to use. And so that dried up. And so the government, because they stick their nose in there, not understanding hospital dynamics and how hospitals run, right? They're just bureaucrats, and all they see is money. And so then they say, okay, you got to get rid of that, and which dried up all of the money set aside for people with no insurance. And then it looks like it's the hospital or the insurance provider who don't have a heart, right? They are the people who deserve to be shot in the streets. No, that's not how it works. It's the laws that are being passed which make it difficult for hospitals to do their job. And so a lot of companies then, seeing that it's a lot cheaper, right? Because they have to do these co-pays, they have to contribute to the healthcare insurance of their employees. So they see that the whole system is cheaper if they go to private surgery centers. And so they deal directly with the surgery center, right? So there is not even an insurance company there that who will basically serve as a middleman to jack up the prices even more because they need a cut, right? So that is basically trying to go back to the way it was back in the day when I was born, right? Going directly to the doctor. And the doctors love it too, because being at a corporate hospital means you have to do massive amounts of paperwork. Like I remember when my personal doctor, my physician, there were certain months of the year where she would not take new patients because they had to catch up on all the paperwork of the existing patients, right? And so then they would have this period of new enrollment, which is weird, right? Imagine going to Walmart or Amazon and they say, sorry, we can't take new customers. If you're an existing customer, sure, we'll take your business, but if you're a new customer, you're going to have to wait 2 months before you can start shopping at our store. That's ridiculous, but that is pretty much what government regulation has done to the healthcare world. That's just one slice of it. I'm sure there is so much more, but that's just a slice of it, right? And so imagine people are saying we need affordable healthcare. No, you just need the government out so that you don't even really need insurance. You just need a way to have to pay for all of these procedures, right? Wouldn't it be awesome if we could go back to that kind of situation? Now, I described how government operates when it came to disaster relief and FEMA after the hurricane in Florida and South Carolina. And I said that it's not that they are ignoring what's happening down there. That's their normal speed. It takes them days and to get into action, to start doing things, to have a plan, because right, they just sit around and get fat off of their salaries because there is no disaster, and so they're not really thinking about how there's no plan in place. And so, and I said in that episode that you will see more of that as we go forward, right? Because all of government is like this now. And sure enough, um, healthcare is the same way. No one's paying attention to the costs, the expenses, right? Who's getting paid this much and what are they actually doing? And so a lot of these people, they simply hide behind their morality, their virtue signaling. Hey, I'm doing a very important job, so leave me alone. That kind of useless, you know, shirking of responsibility. And so if you look over at the wildfires in California, which I talked about yesterday, it's just getting worse, right? Every time you hear a story about that situation, it just gets worse. I remember 10 years ago, I used to talk about, because they would have droughts and stuff. And so I would say, why do they have water problems in California? They're right next to an ocean. I would say that all the time. And it's saltwater, sure, but there's something called desalinization, right? To take the salt out of the water. And they do have a couple of desalinization plants, but not more. And why not? Because the water there, and made a conjecture. I said probably the water there is subsidized, right? That's why you can live in a desert and have swimming pools, right? The water has been made cheap, and so people overuse the water, right? And because the water is at an artificially low cost, right? It's not worth it to set up desalinization plants, right? And so if government just got out of it and people were forced to pay the actual cost of the water, then it would become worthwhile, profitable to have desalinization plants. But until then, you're not going to see more of that. And so the people over there, if you think about it, generally speaking, are extremely, extremely spoiled. I wouldn't be surprised at all if people who live on the East Coast of the United States are actually subsidizing the water in the West Coast, particularly in California. I would not be surprised at all, right? Because taxes work weirdly that way. All right, and so to close up this episode, let's talk about Mark Zuckerberg. People joke around that he's a robot. And so it wouldn't be so surprising to find out that, he has no emotion, really. So he's a sociopath or a psychopath, right? Because he has no emotional response in the way that most general normal people, so called, have. Now, that's not a necessarily a bad thing. I'm not saying he's a mass murderer. I'm just saying he just doesn't have that emotional response. He doesn't have that moral compass. And so hit the way he makes decisions, and other people have said this, he follows the money. Now, when the winds of of politics were blowing to the left, then he censored stuff on Facebook. And now that Trump was elected and Zuckerberg even got turned on by Trump, pumping his fist after getting shot. Well, he's shifting now, right? And so he shifts naturally because he sees that the winds of change have shifted as well. And this is kind of what I meant in episode 264 when I talked about that Luigi guy who shot that healthcare executive CEO. I mean, he clearly is a psychopath, right? And so people like that have to be incentivized to do good. And this is it, right? And so when you have no moral compass and you're just trying to score points, whether the points are just news, right, fame or money, well, then that's what you want. You want them to be incentivized to do things that'll get attention, help them to get rich, but by doing positive things. And if society was actually just, I mean, there was no hypocrisy, there was no double standard, there was not all this injustice in society. But if our society actually was based on justice, true justice, blind justice, and that basically means that there's very little government interference, then people would be motivated to do good. That's what I was trying to say. And so Mark Zuckerberg, there he is, Mr. Robot, you know, following the winds of change, right? And now, if the winds of change were always, now I'm trying to imply that Trump is justice, represents justice, but he is a little bit better than what was there before, right? All the censorship and lockdowns and whatnot. And so, if the winds constantly blew that way, then you would know that people like him would be thinking more positively. What is more constructive? What is more productive? What would make people happier? How can we get more and better information out to the right ears, right? Um, and so right now, all of the incentives are wrong. And we have to fight to maintain awareness and access to good information, right? And so uh, we have to realize there's a lot of socialism all around us. And so Trump is not a panacea. Like, he's not going to solve all these problems, which means you have to continually plan, prepare, and you can't avoid the risk. And so you have to figure out which risks you're able to afford. It's sort of like the Ron Paul way of life. It's very humble, it's modest, meaning that it's not extravagant, but he's comfortable, right? He's not starving to death. And so that's kind of how I like to try to live a humble life, a modest life, but to be comfortable, to make sure that my kids have food and my kids have, they're able to pursue education if they want to. And the whole time, as we live this kind of life, we have to show other people, right, that kind of life, a life of making better choices. And so I thought that was just kind of interesting seeing Mark Zuckerberg doing what he did. Anyway, so that's it. And so in a world where insurance is just going crazy, the incentive is for us to be more careful about our health, right? And so that as we get older, we're not always going to the hospital. And that's kind of how it should work, right? Because we don't want any of this, we have to be more careful about our health, be more preemptive when it comes to taking care of and dealing with health related issues. But anyway, that's it for this episode. I hope you have a fantastic weekend, and I will talk to you next time.